If you feel that you yourself are facing medical discrimination because a doctor has not been able to confirm your pregnancy or has not been able to find your baby on ultrasound, I assure you that using defensive medicine could help you get an official and accurate diagnosis, pregnancy related or not. Hello and welcome to this video. Thank you so much for being here. I'm so glad you are. I hope you're ready to learn something new. Let's talk about defensive medicine in relation to cryptic pregnancy and extended gestational cryptic pregnancy of 2 to 7 years. Let's start with what the extended gestational cryptic pregnancy says, the community themselves. There's a theory on why an extended gestational cryptic pregnancy is not being diagnosed in the medical field, and it's not being acknowledged in the medical field, and it's not being researched in the medical field. So what is this theory and what's the conspiracy behind it? There is talk of conspiracy in the cryptic pregnancy community referring to the confirmation of a pregnancy with little to no HCG, or a pregnancy that is not testing positive in urine, blood, or ultrasound. Therefore, this particular baby is cryptic and is slow growing. The theory within the cryptic pregnancy community is that the medical or modern medicine, the medical community is purposely keeping extended gestational cryptic pregnancy of 2 to 7 years. They're purposely keeping this special kind of pregnancy a secret. And that the doctors use defensive medicine to avoid confirming the pregnancy itself, or to take back a previous confirmation of pregnancy. So let's go ahead and discuss what exactly is defensive medicine. Defensive medicine is when a doctor practices medicine not to help the patient, but rather to prevent legal action, which would be a malpractice lawsuit, if a problem should occur. So defensive medicine itself often leads to over-testing and over-treating the patient. In defensive medicine, the doctor goes beyond what is usually necessary for diagnosing and treating, so they can ensure they are not missing any unlikely but possible conditions in order to prevent a lawsuit from happening in the future. Defensive medicine rests on the premise that we must do things to reduce risk. So the doctors practice this in order to reduce the risk of them being sued by the patient in the future for either misdiagnosing or prolonging the diagnosis. So saying that using defensive medicine is used to prevent pregnancy confirmation is pretty naive, and I'll explain why. So because defensive medicine rests on the premise of reducing risk, a doctor purposely not diagnosing or not confirming a pregnancy would increase the risk 100%. A doctor purposely not diagnosing a woman who is pregnant, telling her that she's not pregnant when she actually is pregnant, would increase the risk to the mother. It would increase the risk to the baby, or possibly babies if there's a multiple gestation. And it will increase the risk for the doctor and every single medical professional involved in this woman's care after the fact, because the doctor would put in the medical chart that he has seen this person and purposely not diagnosed them with pregnancy, even though they were actually pregnant. Every single medical professional that came in contact with this woman would ultimately be responsible for missing this diagnosis as well, or purposely ignoring it or trying to keep it a secret. So if a doctor was in fact purposely trying to mislead a woman by telling her that she was not pregnant when she was in fact pregnant, would increase the risk to not only himself getting a lawsuit, but it would increase the risk of possibly further being responsible for the death of the mother or the death of the baby. In fact, I myself recommend that all doctors and medical professionals purposely practice defensive medicine when dealing with a woman who believes that she is years pregnant. Order all of the tests. Make all the referrals you can as a medical professional. The more opinions on the case, the better. The more people who have looked at this patient and have evaluated this patient, the better. The women in the extended gestational cryptic pregnancy community of 2 to 7 years need more than just one opinion. They need options. And if that means more medical testing before they can be satisfied, I don't see the harm. So the more these doctors refer them to other doctors and they get more testing, the more tests that they're presented with, the more likely they are to accept that their uterus is empty and that they are not pregnant. Also, the more medical testing that they have, the more likely that could happen is that this could lead to an unknown or a previously unexplored diagnosis, which would benefit the patient as well. So I just wanted to make this video to make it clear that defensive medicine is not preventing your pregnancy confirmation. It's not preventing. A doctor using defensive medicine would not prevent them from confirming your pregnancy. There are many other things responsible for your pregnancy not being confirmed, but it is not the it's not the over ordering of medical tests that is keeping your baby from being found on ultrasound, and it is not the over treatment of a condition that is preventing your baby from being found on ultrasound. Defensive medicine is not being used to hide a secret new special kind of pregnancy. Defensive medicine is not being used to take back a previously given pregnancy diagnosis. So stating that a medical professional has confirmed a pregnancy, even written it up, then taken it all back and refused to treat a cryptic mom as if she was pregnant while still keeping the first diagnosis on record is defensive medicine. This is untrue. This is uneducated and a misleading statement. Keeping the first diagnosis on record and stating that you're refusing to treat them would ultimately incriminate the doctor. The entire point of a medical record is to keep track and protect the patient. So this doctor writing it up in this patient's medical record and admitting that they saw this patient and that they retracted a diagnosis of pregnancy and refused to treat her as if she was pregnant, and then she was later, days, weeks, or months later, found out that she actually was pregnant, and this doctor refused to treat her as she was pregnant and retracted his diagnosis, and that original doctor was wrong. Having this info in her medical chart would be all the proof that this woman needs for a medical malpractice lawsuit. Majority of the time, even if the medical professional is acting in a way to protect themselves legally, this also helps the patient get to a full and accurate diagnosis because the doctor is making sure they are covering all their bases. Because let's face it, humans act more responsibly when they have to be accountable, right? And the medical chart of every patient makes every medical professional who touches that patient responsible and accountable. So if you feel like a doctor or medical professional is being dismissive or not treating you fairly by stating they are not going to order certain tests, I want you to say to them, please note that in my medical chart that you have refused so-and-so tests, or that you're choosing not to run these tests, and I bet you $100 that they will change their minds and order these tests for you. Because again, a patient's medical chart is there, and its purpose is to protect the patient. If you yourself feel that you're facing medical discrimination because the doctors have not been able to confirm your pregnancy or find your baby on ultrasound, I assure you that using defensive medicine could benefit you and help you to get an official and accurate diagnosis of pregnancy related or not. It'll help you get to a diagnosis. So thank you so much for watching. I hope you're happy. I hope you're healthy. Stay blessed, friends. I hope you learned something new. Bye.
Hi, if you're looking for more information on cryptic pregnancy, phantom pregnancy, or any kind of pregnancy experience, please visit my Facebook group, my Facebook page, as well as my Instagram account. Again, thank you so much for watching. I hope you enjoyed. Bye.